Hello everyone, myself Dr. Kanchan Sharma and welcome to my YouTube channel. In this video, I'm going to tell you each and everything about ovarian cyst, what are the type, what are the causes, symptom, and at last I will share holistic Ayurvedic treatment which is totally side effect free. So do subscribe my channel and let's get started. In women, both sides of uterus, ovaries are situated, and when in these ovaries, fluid-filled sacs grows, whether it is inside or surface of ovaries, that we call ovarian cyst. Ovarian cysts are very common. These are of two types. The first one is simple, the second is complex ovarian cyst. Complex ovarian cysts are obviously, they are complicated. They are like endometriotic cyst, polycystic ovarian disease, or dermoid cyst, or cystadenoma. So this is a vast topic and I will definitely make a video on these cysts also. But today's topic is simple ovarian cyst. So today we will talk about the simple ovarian cyst. The simple ovarian cyst is of two types. The first one is follicular or functional. The second one is corpus luteum cyst. So first we will talk about the follicular or functional ovarian cyst. See, if the cycle is normal, it is of 28 to 30 days cycle, then definitely on 14th day or 15th day ovulation occur. What is ovulation? In this, a follicle releases egg on 14th or 15th day. But when the follicle doesn't rupture egg, doesn't release egg and it continues to grow, then it becomes functional or follicular cyst. So what are the causes of follicular ovarian cyst or functional ovarian cyst? The first and obvious reason is hormonal imbalance, because estrogen, progesterone and LH, FSH, these hormones actually control our cycle. So obviously this is the main reason. And if we talk about the Ayurveda, so Kapha dosh imbalance is the main reason. Sometimes Vata and Pitta also involved, but the Kapha dosh imbalance is the main reason if there is cyst anywhere in the body. So for the follicular cyst, this is the main reason. Now the question is, are they problematic or what kind of problem can occur? See, lots of problem can occur. If an egg and sperm meet, then fertilization happen, then implantation happen and pregnancy occur. But in this problem, you see there is no release of egg, then definitely it is very obvious, then there will be no pregnancy. So problem with conceiving is very obvious, and this is the first problem with simple ovarian cyst. And because of hormonal imbalance, this is the main reason for follicular cyst, then definitely there will be problem with the conceiving or any other problems can also occur. Now let's talk about the symptoms. So most of the time there are no symptoms for this follicular cyst. Sometimes this cyst resolve itself, but sometimes patient tells that there is pain, there is bloating and painful intercourse is there and back pain is there. So this kind of symptom also patient can face. The second cyst is simple corpus luteum cyst. During ovulation on 14th day, the egg releases. So when the egg releases, the follicle dissolve. But sometimes when follicle doesn't dissolve and filled with fluid, then we call it simple corpus luteum cyst. So in most of the cases, these kind of cysts go away on their own. But if patient complains that there is a pain and the cyst is becoming enlarged, then definitely there are chances of rupture, which is typically an emergency condition. So monitoring is necessary. Otherwise, corpus luteum cyst is not very harmful. There is one more cyst. If these cysts filled with blood, not with fluid, then we call it hemorrhagic cyst. This is also a vast topic and I will definitely try to make a video on hemorrhagic cyst separately. Now let's talk about the diet. If we talk about the diet, so because of the Kapha dosha imbalance, Kapha dosh aggravation, we have to avoid that kind of diet which aggravate our Kapha. So Kapha pacifying diet is advised. What kind of diet that is? You should avoid excess sweet, excess sour and excess salty food and introduce spices like turmeric, ginger and cumin, carom, these kind of spices in your food. And turmeric milk is also very helpful, so you can add that also in your diet. Try to eat fresh fruits and vegetables and avoid all the refined products. Avoid all the junk food, avoid processed food, these kind of food, and avoid heavy digestive food. Try to intake very easily digestible food. Now let's talk about the yoga and pranayam. Of course, we must avoid all the sedentary lifestyle and stress from our life if we want balanced hormones. So for balancing our hormones, yoga and pranayam is best. So if our cyst is not very large, then we can follow any kind of exercise. You can go for pranayam like Anulom Vilom and Bhramari, and yoga poses like a butterfly, reclining butterfly, cobra pose, bridge pose. These are very helpful. Now let's talk about the Ayurvedic treatment. Let's start this with a very effective home remedy. My very effective home remedy for simple ovarian cyst is very simple: fenugreek seed. You have to take 1 TSF, 1 teaspoon fenugreek seed, and just crush them and put in 1 cup of boiled water and leave it overnight, and in morning you have to strain it and drink it lukewarm empty stomach. This is really a miracle, and just do it for 30 days and you will get the results. Now let's talk about the treatment. Treatments are you have to take kanchan gugul, 2 tablets twice in a day after breakfast and after dinner. The second one is Sanjeevani Vati, 2 tablets after breakfast and after dinner, and take this with Ashokarist. Ashokarist, you have to take 20 ml of Ashokarist, add 20 ml of water, and just take after the breakfast and dinner. So this is the whole regime. You just have to follow each and everything for 1 to 2 months, then go for a scan and just see the results. Definitely you'll be surprised. So this is my video for you. I hope you liked the video. Thanks for watching my video.